Hello, I'm Raffaele De Caterina from the D'Annunzio University in Chieti, and my presentation will be dealing with the issue of non-vitamin K antagonist oral anticoagulants in atrial fibrillation and update. The specific question that has been asked to me is when to give NOACs, as we call them now, and to which patients. And in order to address this question, I will review briefly the most updated information on NOACs in atrial fibrillation. The first slide that I will present is quite important because it tells very simply that these are life-saving drugs. There is a very important meta-analysis by Raff that addresses this issue of death reduction compared with warfarin in NOAC trial against warfarin, with the demonstration of a 10% relative risk reduction in death. So this is a compelling argument for the preference of NOACs over warfarin overall in general in patients with atrial fibrillation when anticoagulation is indicated. And this is indeed reflected by the latest versions of the European and also American guidelines that tell clearly that NOACs are now the preference when you have to start anticoagulation in patients with atrial fibrillation. I will also address specific subsets such as those with valvular heart disease, a category that needs a clear definition, which is now possible. So the only categories for whom NOACs are not to be given are patients with mechanical heart valves and with moderate or severe mitral stenosis. All the other types of valvular heart disease are susceptible to treatment with NOACs. Then I will address registry data, the use of NOACs in the elderly, the issue of dose reduction when this is recommended, especially in relation with renal insufficiency. And in essence, I will answer that NOACs are now the #1 choice for most patients with atrial fibrillation. There are some differences between one NOAC and another, so one can ideally tailor the use of a specific drug to a specific patient, but this is a subtle play of art, I would say, in order to choose the best drug for the best patient. But overall, the category is clearly a winner compared with the good old warfarin. The use of warfarin is now largely restricted to patients with mechanical heart valves and, as I said, mitral stenosis, moderate to severe mitral stenosis, in which there is not yet a specific trial with a NOAC. Thank you very much.